Hi, I'm John Green.
I'm Aaron Carroll.
And we are back today to answer your questions about healthcare. Specifically, I'm going to ask the questions, and Aaron is going to answer them because he's the doctor. Is there truly a medical benefit to circumcision?
Oh, this one is like gonna raise anger. So there's some good evidence that being circumcised reduces your chance of contracting HIV and some other sexually transmitted infections. There's some decent evidence that it might lower the risk of urinary tract infection or penile cancer. But all of those differences are pretty small.
Wait, you can get cancer of the penis?
Yes, you can.
Oh my God.
I'm not laughing about penile cancer, of course.
What's the treatment, Aaron?
I would imagine removing the penis if it's too big, and perhaps chemotherapy and or radiation. But yeah, so again, there is some...
If the penis is too big or the tumor?
No, well,
that was a very ambiguous it.
I would say the cancer.
Oh, okay.
How quickly can. Having said that, so yes, there is some statistically significant benefit, but it's not high enough that we should like make any kind of recommendations and say like universally we should circumcise. Or that is, but it's enough of a benefit that we should make the argument that if people want to get circumcised, we should make it easy for that to happen.
But a lot of times it's babies who don't have a want.
Right, which is
that's why the ethical
and it comes in later because it's, of course it is much more difficult and problematic to have a circumcision later in life. So then there's a debate to be had. You know, it is a very tricky question.
I'm going to stay clear of it.
Yeah, there you go.
What is tunnel vision, and why does it happen?
They're asking short-term and long-term. So if you're talking about like chronic, it's the idea that you start losing your peripheral vision and can only see sort of a circle left. That's usually caused by damage to the optic nerve or to some other area of the nervous system in such a way that, you know, from glaucoma or high blood pressure or something else with long-term damage, and the way you fix that is by reversing whatever the cause is. Short term, you can get that sometimes when you're going into shock. Like I, once in a while, will go vagal and I'll pass out. You know,
really?
It's happened to me a number of times.
You just faint?
I can always tell when it's coming, but yes.
One of the things I like about you is that you also have some weird health problems.
Oh yeah, and this, you know, anxiety and all that comes into play too. It's just not my number one. But so when I know that I'm gonna faint, or I know I'm gonna pass out, the first thing that happens is I can like hear a ringing in my ears and I get tunnel vision. It goes like that.
I get tunnel vision when I work out too hard. And then I do sometimes faint.
Do you faint? That's happened to me more than once. I was with a friend who still makes fun of me for that.
I said to my personal trainer not too long ago, I'm going to barf.
Right.
And he said, you're not going to barf. Just work through it. And then I was like,
no, see, I don't barf. I just say, I'm going down. And everybody says, what does that mean? And then,
and then you're down.
I once said it to Amy, to my wife, and I said, I'm going down. I handed her our baby and passed out on the table. And I woke up, she's on the phone with 911. Well, I told you I was going down. You didn't need to do this. But
how come we lose muscle mass over time?
You know, it's funny. It's like you sort of gain muscle mass to your 30, and then it starts to trickle off. Partially that's hormonal changes, partially that's people become more sedentary and they don't work out as well, sometimes it's dietary. It's just the way bodies are built. You sort of develop for a while and then it's a long, slow decline to death. But having said that, you can avoid that. Exercise will help to reduce that muscle mass loss.
How's P90X3 going?
It hurts.
Yeah, I'm very sore today.
It hurts.
When are they going to make a better unemployment insurance than Cobra?
We have one already. I mean, that's what the Affordable Care Act is. The idea now is,
Obamacare.
You don't have to get Cobra anymore. The second you lose your job, you can get regular old insurance, which is going to be way cheaper than Cobra.
I started using a standing desk at work recently. Is sitting all day really killing us?
It's not causal in the sense that we don't have good randomized controlled trials, but there's a lot of cohort studies that show that being sedentary is really, really bad for you. And so the observational data is good enough to make us all want to get up and walk around more. I endorse your standing desk. It's a good idea.
All right. How regularly should I see a doctor for a checkup?
Well, that depends on your age. I mean, babies should be going multiple times a year. And
how often should I go?
You. See, you really...
26-year-old healthy male.
Where's he? Anyway, so a 26-year-old are arguably there really is nothing to do almost every year. at your age, you're getting closer to where there are recommended things to be followed every year. Having said that, there was just a great piece in the New York Times by Zeke Emanuel who was arguing that we don't even need yearly checkups. There's no evidence for it at all. But there are things we're supposed to do every year in screening tests that should occur every year. You should be getting certain vaccines every year. And the way our system is built, we need a doctor visit to do a lot of those things. So probably still every year. And women are a whole different story because you do need often gynecological care and screening tests that absolutely require every year. So for women, at least, for absolutely every year for a woman, and probably for a man.
Is BMI, body mass index, really a good marker of health and weight? It's a 160-year-old test, really.
Well, we shouldn't ding it because it's old. Having said that, BMI is imperfect, just like any one metric is imperfect. It's very possible to be very muscular and still have a high BMI and still be very healthy. But, generally, still, it's a decent metric for obesity. And that has been correlated with a lot of bad outcomes. So it's one of the better ones we have, but I totally agree that it's not perfect.
Height to waist ratio is something that I hear a lot about.
That is one of the ways of calculating BMI. I mean, the perfect way to calculate BMI is to put you in one of those like body pod chambers where they figure out how much fat you have and how much, your sort of body mass. But having said that, a number of height to weight or height to hips are, there's all these different ones, but it's all different ways of calculating BMI.
You know what I've noticed is that people with abdominal fat have much higher risks of everything.
Yep.
And I have that. And it's not my fault.
Well, a little.
Well, I like to eat fatty foods.
Yes,
but it's not my fault in the sense that just doesn't seem fair. I could
fair. Well, I didn't say
else.
fair, but I mean, yes, if you exercised more and ate a healthier diet, it is likely you'd have less abdominal fat. But this is not about blame. It's not.
Heladella asks, are there benefits to cutting red meat out of my diet?
If you eat a ton of red meat, yes. If you eat very little red meat, probably not much to be gained.
But you shouldn't eat a lot of red meat.
You shouldn't eat a ton. All the studies that show that red meat's terrible for you are all talking about reducing the number of servings with an S a day of red meat. Most of us aren't eating multiple servings of red meat a day. If you're eating that much red meat a day, you probably could stand to cut some out. But a little bit of red meat is probably fine.
Am I more at risk of cancer if my relatives have cancer?
I would say depends on the cancer, but the general answer would be yes. Yes, there are genetic components to many, many cancers, so certainly if many relatives have a certain type of cancer, it raises our index of suspicion for you. But it's also not a lock. Just because a relative has cancer doesn't mean you're going to get it.
Rona asks, are scientists and doctors any closer to determining why nut allergies are growing so fast?
No. There's a lot of theories out there. Some people think it's the food that we eat, that somehow it's been processed a way that's making more people have allergies. Some people believe that it has something to do with pollution or the general environment. But there are also a lot of people that believe not exposing kids in utero and as small babies to these things makes them more likely to develop the allergy. So maybe our paranoia about it, which is unfortunately causing the rise in the numbers. So nobody really knows. It could be any or all of those things.
3 more questions. Rachel asks, what is a hiccup exactly?
So it's a spasm of your diaphragm, the muscle at the bottom of your lungs here, which helps move everything up and down. And when that happens, it results in sort of a secondary snapping of your vocal cords that produces that hic sound.
You know the people who have the hiccups regularly for their entire lives?
Yeah, then they lose a ton of weight. They're always so thin and scary.
Yeah, that's one of my big anxieties.
There you go. Well, that
is that I'm going to be a hiccup person.
That or a horrible degenerative mental illness, one or the other.
Or both. Besides medications, what can I do to deal with the allergy I have to my pets?
Oh, okay, so
I have an idea.
There's a number, well, yes, yours is going to be worse than mine. So what you could do is, first of all, never let your pet in the bedroom. You spend a significant amount of time in the bedroom, and you don't want them in there. The second is try to eliminate carpets in your house, because that is where all the dander, it's not the hair. Everyone thinks it's the hair. It's not. It's sort of the shed skin, the dander, and it can collect in rugs. When you vacuum, you can wear a mask, and you can just make sure, or get someone else to do your vacuuming, because that's when it sort of gets spread up into the air, and have someone else wash your pets regularly and brush them to get all that dander out. But of course, getting rid of the pet would also help your allergy.
Find a great home for that pet. And our last question from Savannah, how do you feel about abstinence only being taught in schools?
Oh, so I've not seen a lot of good evidence that says that abstinence only is better than teaching kids about sex and how to do it safely. And the problem is that usually we make it an either or. And so if we're saying we're going to do abstinence only or we're going to do comprehensive sex education, comprehensive sex education is better. However, adding abstinence as an option into comprehensive sex education, I don't think many people have a problem with that at all, saying you could just not. Okay, but it probably needs to be part of it. The problem is when we say, let's only talk about that. That can be problematic.
Aaron, thank you for answering all of our questions. I have one last question for you. When am I going to die and how?
2056 and by nuts.
I'll take it. I would take that in a second. If there was a deal I could sign right now for 2056 by nuts, I would take it.
How old will you be in 2056?
Old enough.
I was going to say that I give you enough years of life.
Wait, no. It's 42 years from now.
No, I've almost robbed you. You should get more than 80.
80. Oh, I would take 80.
Really?
Oh,
you're going to get 80. We've talked about that. You're going to get 80.
I'd be delighted to get 80.
You'll get 80.
All right.
I'm
good.
very confident you'll get 80.
And I've always wanted to die by nuts.